Hello everyone, this is Young and I would like to welcome you to my channel. I am going to have a quick chat with my 4 good friends from MD1 at the University of Melbourne, Shepparton campus, and we want to see what studying medicine is like for them.
So where's this going, just out of curiosity?
YouTube channel, but I will edit it before I put it up. So if any of you doesn't want it to go out, then we'll dish it. Yeah?
No, we're gonna be famous one day.
You guys are already famous.
30 seconds little 5-second video. I remember Ali Abdul.
G'day, I'm Tim, one of the first year medical students here at Shep. I came to medical school straight out of La Trobe University, where I studied biomed for 3 years. I started that straight out of high school. So I grew up in both Woodend down in the Macedon Ranges of Victoria, and Catamatite, which is just a small little dairy farming town just up the road here.
I'm Srishti. I'm also one of the first year med students at Shep. I was part of the La Trobe guaranteed biomedical science pathway. So I studied that for 3 years at the Wodonga campus for La Trobe. And before that, I studied high school in Griffin, New South Wales.
Yeah, cool. My name's Oscar. Yeah, same as these guys. I was part of the La Trobe Guaranteed Pathway, but yeah, I studied in Bendigo, not Albury-Wodonga, from Kahuna, which is just a small town, 2,000 people, sort of northern Victoria on the Murray. So yeah, through and through rural kid, and yeah, here studying medicine, so very excited.
Hi, my name's Archma. I'm a first year medical student. I did the La Trobe Biomed Med Guaranteed Pathway, and I'm from Bendigo as well.
Awesome. Tell us what you enjoy about med school.
What I enjoy the most about med school is definitely the fact that we get to see patients in first year. Is that right? No,
yeah, I can go next. Yeah, I don't know, I just love it. Just love studying, love learning. Massive nerd, so I just get right around it. And that's pretty much it for me, yeah.
Yeah, so the best part of med school is actually finally doing the clinical skills. So after 3 years of theory in undergrad, it's nice to finally learn those practical techniques.
And I had a couple of things. I'm loving being here at the moment. So mainly because you're surrounded by people who you're inspired by, right? So you wanting to become a doctor and you're surrounded by people who have already gotten there. People who have lived the life that we're looking to live in the near future, which is just incredible. But also secondly, because we're given an awesome opportunity to study our whole degree here in the country. And similar to Oscar, I'm a through and through country kid, born and raised in the paddocks, and really enjoy being here. So studying up here at Shepparton at the moment brought me closer to home. Gives me that connection still to, I suppose, the farming side of me, the kid who still likes to get out 4-wheel driving and enjoy the bush, and means that I get to integrate it with my biggest passion, which is medicine.
What other passion do you guys have other than med? Following from Tim, what Tim said.
I can just follow straight on. Yeah, well, Tim and I, we've been out 4-wheel driving and camping a bit. I think we sort of was an important part of growing up. As family, and we find that a good sort of stress reliever. It's good to get away in the bush and just put the textbooks away and just relax for a bit. So that's something that we've been getting into and hope to continue doing over the next few years. But
Absolutely.
Outside of med school, I like spending time with my family and friends and travelling and just eating out and seeing new places.
I would tend to agree. I think going out for brunch is a bit of a hobby of mine. And I also dabble a bit in photography. I'm the annoying photographer for all my friends. Yeah.
What's the best place to go to in Shep?
Best brunch.
I think I got 2 recommendations. I'll say Belsibo.
Yeah.
Definitely Belsibo for your dinners and
brunch. Brunch is good too.
And brunch. You've got the milk bar if you're looking for a Vietnamese fusion if you're into something different.
Yeah, that's good.
you guys go.
Belsibo. I reckon Belsibo if you're wanting some of a more like elegant touch to brunch.
Yeah.
But I would say milk bar is pretty good too.
And I reckon nothing beats a good old fish on the Golden, which is just 5 minutes down the road.
What's med school like in general?
Not too bad. It's it is what you make it. You can spend a lot of time studying and really excel. Spend a lot of your time doing the academics and whatnot, but it also gives you the flexibility given that MD1 is pass or fail, it's technically ungraded. it gives you the flexibility to go and also, I suppose enjoy some other passions if you want. It really is what you make it. Between the four of us, there's a massive amount of difference. I'll spend a lot of my time out four-wheel driving and camping and whatnot. Oscar will do something somewhat similar. And some people will enjoy, spending time in the textbooks a little bit more.
I think because we're still in first year, we're still really not in the full, in 7 weeks, I don't think we're in the full depths of it, because we're still doing that theory, and coming from biomed, I feel like there's been a lot of repeats, and I feel like we've seen a lot of it before, so I feel like we still haven't really gone fully into that med school.
Yeah, we don't probably quite know what it's going to
Yeah.
be.
Yeah.
But so
I
far
think-
it's been pretty good.
Yeah, it'll change a lot in the next couple of years, I feel, and we'll be getting way more in depth, and I think it'll be such a different vibe. Like, we will not be living the lives that we live right now, probably.
What lab are you guys living now?
No Bell Seaboat dinners and lunches.
I think that'll still be possible though.
Yeah, it'd be possible.
I think there's still been a lot of new things. Maybe, I don't know. I still found I was learning quite a bit, especially for the cardiovascular block.
Yeah.
Talk about the cardiovascular block.
Yeah, I really enjoyed it because for cardiovascular, I think everything just comes together and it all merges together to finally form this final understanding, I feel. Whereas for our first block, which was foundations, it felt like lots of different things. Don't know, would you guys tend to agree with me? For cardiovascular, I think it just flowed more integrated. I liked that.
Yeah.
It was very interesting.
From undergrad, where we looked at anatomy of the heart separately and physiology of the heart separately, I feel like I like it. Now we look at it more as like heart failure, and we're integrating the anatomy and physiology and the pharmacology, like what drugs and the treatment together. And I feel like that is very different, and it kind of gives you the complete picture of like each disease, rather than, you're not just learning anatomy or physiology or the pharmacology, but it's all, it makes sense, and it's like, it shows you that they're all combined.
No, but I think having all the systems together allows you to go into more depth if you want to learn it. Like, I think it caters to all different learning levels, and if you want to just learn the most important things for that system, you can. But if you want to go and learn a bit more and look into the ECGs and stuff like that, that even though we don't really need to cover in first year, you
Still
can
interesting
go
though.
and learn, sort of
Definitely.
go down the rabbit hole and learn about some different stuff.
Yeah.
So.
Even if you wanted to look at combination drugs, for like what goes with statins, which they briefly mentioned, and you're interested in that.
Yeah.
I felt like I was interested in knowing like how that worked. So I feel like, yeah, you could definitely find a little area that you like.
Yeah, absolutely. The flow is really nice as well. So we start with the foundation block where we got a really good basic understanding of biochem, a little bit of pharmacology, physiology and anatomy. And then we moved into cardiology, and that's a great way to start because cardiology is, I suppose, relevant to just about every specialty. It's going to tie in at some point in our careers, so a really, really nice area to get that as a nice foundation for us to keep going through med school.
Yeah. It also relates to a lot of the different systems, like relates to respiratory system, renal system really well. So I think it's a good setup to get us thinking about the future blocks a little bit.
Yeah, that's been good fun.
Talking about the future, what advice do you have for pre-med that are looking to start MD1 next year? How can they get ready?
Depending on the program that you want to get into, there's different requirements. Some programs require the GAMSAT, and so obviously you've got to spend a little bit of time at least getting familiar with the organisation of the GAMSAT and how it's set out, so that you're not seeing it for the first time when you arrive at the assessment centre. But also, your WAM or your GPA from university in your undergrad program is going to contribute quite heavily. So working hard, especially during your last year, smashing the textbooks and getting on top of work. As much as it'd be nice to say it doesn't matter, unfortunately med is one of those courses where it is quite competitive. You do have to try quite hard in undergrad to make sure that you've got the scores to be able to push through and start med immediately following university.
Although it was granted though, you still have to maintain a WAM.
Yeah, maintained a weapon still.
That was,
Get a 90
It was
for the first start,
achievable.
and
It was
just
very
go
achievable.
you had to get, I think, a 70 WAM
Yeah.
It was-
3 years.
Yeah,
or-
very
very
achievable.
maintain a 17 WAM, which was very achievable, and I think after your first year you kind of had an idea of what grades you need in the later years to pass.
Yeah, it definitely wasn't too stressful.
Yeah,
was
it wasn't.
No, I
very
wasn't
stressful.
stressed at all, to be honest.
Yeah. I wish I learned that. But yeah, I think maybe if you do want to have a head start, it's probably really good to learn everything, take in a lot of the concepts that they teach you in biomed.
In that stress-free environment,
Yeah.
if you're in the guaranteed
It kind of
program.
prepares you for this course. I feel learning the biomed content.
We'll just enjoy it and just
Yeah.
learn.
Yeah.
Like, don't worry about your grades. You got
Exactly.
guaranteed.
Yeah.
And same as after the pass fail, like just enjoy learning, and you're gonna go well. It's pretty simple, really.
Part of med school is definitely not just the studies. I feel like it's kind of the experience as well, and I think it's great to go on with like a stress-free mindset to take in as much of it as you can, rather than.
Absolutely. Yeah, it's very much about the interpersonal skills developing as well, which is actually a great point. So to get into any of these programs, we all had to sit interviews to get into any med program in Australia at the moment, I believe. You've got to sit through an interview. It's an interesting process. Lots of people have different opinions on how to best tackle these. Some like to prepare like nothing else and get tutors and all that sort of stuff. I personally didn't go down that route. My philosophy was, if they don't like me for who I am, then I don't want to be a doctor. And that's a very controversial philosophy. But it's the one that I went in with. It gave me, I suppose, a little bit of stress relief, thinking there's not too much right now that I can do to change the outcome of what's going to happen. I'm just going to put my best foot forward and show them who I am as a person, and hope that they're happy for me to be, a doctor eventually as part of their program. What did you guys find?
Yeah.
Same thing, yeah. You want to go?
I would say I really enjoyed the interview. It was nice, like not just studying, it was nice talking to people. And I actually found it quite fun, like all the different stations, you just get to have a chat almost. And I would agree with Tim, like I didn't really prepare that much for the interview. I just had a sit down before the interview and thought of like all the different, maybe just volunteer experiences I've done and what I wanted to talk about in the interview. But other than that, I didn't really prepare much for it. I was like, basically I just went in thinking I'm just going to have a nice chat with them and show them who I am. And hopefully they think it's a good personality to be a doctor.
Yeah, I think you're just going to be genuine, don't you?
Yeah.
Like, that's the thing. But I think like doing well for the interviews, like it's not to say that you don't do any preparation, because really the preparation should begin 5 or 10 years ago. Or not 5 or 10 years ago. But it should start years ago, when you start trying to work on yourself as a person. And work to instill good values that I think are going to make a good doctor. Like it's something that you should be continuously doing and trying to improve. So it should come naturally, because if you can be your best person and be yourself, and that's going to be really beneficial.
Yeah, I think I agree. I think they are looking, because I feel like a lot of the times people will leave, like when they ask you like, why do you want to become a doctor, I think people feel like I need to say a specific answer or like a specific sentence. But I think they love that people show their individuality and like why they want to do it, like not just, I think it's very important to show your like why you want to do it, your experiences, and show like your genuine personality out there. And I think that really gives everyone, their best chance, like, because they're like, you're your unique self, and that is what they're probably attracted to.
They truly just want to get to know you, I think. They really do. They want you to do well as well. They're not there to trick you. They just want to have a chat to get all the good parts of your life out of you, to try and get to know you.
What's the structure of MD1 program?
Well, it's just sort of, they go through all the different organ systems, I think, in the body, and we just sort of work through. I think first semester we got foundations, which was just a bit of immunology and a few foundational principles. And then, we're jumping into cardiology, we've just finished that. And I think we got pulmonary, so respiratory, and then we just start going through, kidneys, gastrointestinal tract, and we just, work through the whole body, I think.
I think it's set up well in terms of content-wise, and apart from the actual content, like every couple of weeks we learn a new clinical skill. So we learned how to do IM injections during the foundation block, I think it was. It was a hospital day, so every Thursday we were either at the hospital or at the GP clinic learning something and getting some experience. And we do have one Thursday off during the month.
We've got the case-based learning as well, where we're just not doing theory, but we've got an actual clinical case that we work on at the start of the week. and the biomedical content of that week relates to the case. So it all ties in really well, and throughout the week you're repeating the same content, really getting it in your head, and you have that case-based class repeated on Friday, so you can consolidate all the information from that case with the biomedical knowledge that you've learned from that week.
Ties the content together.
Yeah, absolutely. And then we also, with the clinical skills stuff, we also get to get hands-on with a practicing doctor who's also teaching for the university. So we get to do that once a week, and we learn a different type of clinical skill. So whether it's something like taking a history or performing a certain type of exam, or looking through different blood results, all these sorts of things. And we get to work through it with somebody who actually does it every day, which is really cool.
The biggest thing I got out of PP was chatting to a real doctor about their experiences and trying to learn from that, and also listening to everyone else's perspectives, because ultimately medicine isn't just studying textbooks, right? It's also communication and learning how to interact with patients of all different backgrounds properly, and I think PP kind of ties that together a little bit, ties more of the human side of medicine more. Yeah, that's right. So for those who are super confused, PP, or professional practice, is a class where we get to go in and debate different medical ethics and laws and all this sort of stuff, what we think is right and wrong, and how we can best, I suppose, change our practice to get the best patient outcomes, not only from a medical perspective, but also psychologically, socially, and I suppose tying that in with that whole community health approach that we're taught as well.
Yeah, I think we have a physio as a professional practice tutor, and I think it's great to get that insight as well from. Yeah, and I think you get to hear what other people's experiences at GP are, like ethical/moral things that come up in their workplace. So it's great. I think it's really opened up my mindset. Those little activities that we do.
Yeah.
Absolutely.
Even working as a team. Like, we all know it's important, right? But we have activities in PP that actually show us how important it is. And getting that perspective does open up your mind, I think.
I think it's not something you recognise until sort of after the fact that it was beneficial. Like, you sort of come out the classes and
of course we do work in teams,
like, why do we do that? But then you sort of look back a few weeks later and you think, it was actually sort of good that we learnt sort of what people's strengths are and weaknesses are and all that sort of stuff. So
absolutely.
What's the most challenging element of med school?
Personally for me, I think it's the amount of content and self-discipline. I think it's about maintaining, having a good routine in the first place, staying motivated to do the work. And there's a lot of content, and I think it's sifting through and looking at what's important and what's not important. And it's, personally for me, also, like, I love detail and I love learning everything. So it's like, no, you cannot learn everything. You just have to learn the most important information and sift through what's important and what's not important.
Yeah, I think the same. I'll probably need to spend a bit more time on myself and keeping all that in check, because I think you can get caught in the rabbit hole of trying to know everything, and someone might answer a particular question that you didn't know, and you think, all of a sudden, they know everything and I don't know anything. But there's equal facts that you know that they probably don't know. So I think it's hard not to compare yourself to others, but I think it's important to sort of just stay in your own bubble and just work on your own goals and all that.
I would tend to agree with Oscar. I think it's so easy to just fall into the trap of comparison. Like, they know so much, I feel like I don't know anything about that topic. But then you do have to remember that the point of your peers is not to compare. I think it's more so to try and learn from them, and vice versa, also teach them. So yeah.
I think it's challenging to not lose, I suppose, touch on who you are. Medicine is a course that I suppose takes up a lot of your time, and when we got into this program, they accepted us because of, I suppose, who we were a few months ago. They don't want us to change necessarily. They want to give us some new clinical skills and teach us how to talk to patients in a professional way, sure, but they don't want us to fit into a really tight personality, I suppose, construct of the ideal doctor. They want us to still bring our own little traits and quirks and whatnot, and I think it's important to trust that you got into this program with those little quirks, and it's okay to hang on to them. And you don't have to be the best part of every individual person in the course. Sometimes it is okay to be, a little bit different or not be great at something or struggling in a certain area. But that's great because that makes you you, and you're in the course for a reason.
Yeah, no, I was going to touch on that too. Yeah, well said. Like, I think that it's easy to go and pick out all the good qualities of everyone and compare them to your bad qualities.
Yeah.
And all of a sudden you feel like nothing in
Yeah.
comparison to everyone else. But I think if you look at each person, not that it's a competition, but everyone has their own strengths and weaknesses. And I think that if you try to take the good bits from everyone else and add them to your own mix, then you're going to be a better person at the end of the day.
It's to learn from them, not compare it.
Yeah.
Yeah, absolutely.
Yeah.